Hey there, going live. I'm going to invite my good friend, my fellow neuro nerd, and co-presenter here. Yay, you got in so fast. Oh my gosh. That is awesome. That is awesome. Of course, my dogs are barking at me the minute I hop on here too. It's something that happens. Um, Okay, let me make sure that you're here, Chels, because your video froze for a moment. You're still here?
I'm here.
Okay, yay, yay. I know we are sharing our collective sadness that we are not at CSM right now. And my dogs are sharing that sadness too. Maybe I should just let them in the room with me. And and in fact, somebody reached out, oh no, what happened? As if like our plane crashed and we didn't make it. No, that is not what happened. But we did make a group collective decision that it was not in the cards for us to be traveling at this time, with everything that's going on in our country, and for our health and for our family's health. And so that was probably one of the hardest decisions I've ever made. And I know you feel the same. And we also worked so closely with Mike Studer to put this presentation together. I mean, I feel like I read 1,000 articles, right? This is what happens when you sign up for a CSM presentation. You just pour yourself into it, reading, discussing, putting cases together, like so much creativity, which I feel like actually Chelsea brought to our group. I wish like I could just show you the slides here, but we decided, you know what, let's go live just for a few minutes and share a little bit about what we learned putting this together. The talk, by the way, I call it the autonomy talk, but it was called Maximizing Motor Learning, Engagement, and Participation Applications in Autonomy. It is all about autonomy, but it's about autonomy for maximizing these things in our assessment, in our treatment, in our overall management of people with neurologic disorders. And we learned a lot putting it together and came up with like a lot of great analogies. We're excited because we can submit, we can do this again in the future. I'm excited for that. But Chelsea, I wonder if I was like going back through our slides again, and your brilliant idea was to bring in the plants. And like, there you are with your plants right now. I wonder, like, can you share a little bit about the plant analogy that we had for autonomy, and you know how that works in a patient scenario? As you get started, I'm going to put my whining, barking dog outside. But yeah, introduce us to the plants.
Yeah, so when we were thinking about how to dive into the literature around autonomy and discuss how important autonomy is in patient care in the clinic, we were kind of drawn to the idea that autonomy really is the building blocks for growth. And so there's this quote that is like, if a flower is not blooming, you don't blame the flower, you blame the environment. And I think that's a lot similar. That's very similar to what we do as therapists. I think it can be easy sometimes to be like, well, somebody's just not motivated, and that's why they're not achieving their goals in therapy. But really, it's all about how could you provide the fertilizer or the building blocks for that growth? How could you change the environment to actually help them choose new decisions that could lead to increased motivation and helping them achieve their goals? So we kind of were drawn to this idea of plants. And so we kind of have this framework of the therapeutic environment being like the weather is kind of like our social and cultural environment. You know, the pruning of the plants is more of our motor control, our facilitation, right? Like pruning the neurons. And then, you know, our watering is like our sensory input. And the soil is really like optimizing our brain for neuroplasticity. How are you setting up the person for success? And then the fertilizer is really autonomy. And there's lots of elements of fertilizer. So my husband's a big orchid guy. I don't know if you can tell by the orchids behind me, but there are different types of fertilizer for different types of plants. And there's three main elements in fertilizer. It's nitrogen, potassium. I have to remember. I have to look that up. Anyway, and
phosphorus. Phosphorus was the other one.
Phosphorus. And there's different percentages for each plant and their individual needs. And so it really applies well to how we can apply autonomy, and the literature on autonomy, which is very vast. It just uses lots of different words in the literature on how we have to apply this in a very individualistic way for the person in front of us. So there's no like how-to garden book for autonomy. There's really being present and understanding the person in front of you. And so our presentation was a guide to help you get in the mindset of how you might start to tune in to what that other person needs, and how you might start to incorporate some decisions that can set up autonomy within your session.
Yeah. And I feel like that once we actually, when we first got together, I mean, we these are topics that we talk about like as a team at Reactive with Mike Studer, I feel like all of the time, right? Like it's a consistent theme. It's a consistent and growing theme in the literature. And when we got together to first talk about it, it was like the plants thing came up right away and we just jumped all over it. By the way, I believe we have the most beautiful slides you would have seen at CSM. So I'm very sorry that you're not seeing. I see Lily on here. I see a couple other people who are at CSM, which by the way, I'm having a lot of like FOMO of like not being there live with you. But I also feel good about my decision, which was right for me. I'm not saying that was the decision everybody had to make, but we jumped on the plants, and made some really beautiful slides, really beautiful analogies. And one of the first parts, which was really where I dove into the literature quite a bit, was like, why should you even care about autonomy? And it's really interesting. The intersection of literature here is really like motor learning, motor control, motivation, psychology, philosophy. And one of the very first pieces that I put together, which was really hard for me to read through this literature actually, because it was like dense philosophical literature, but it was really about this idea, you know, I think we think of autonomy as like, oh, this is a fundamental need for people, right? Like people should have autonomy. And this idea came up that I really, really loved and started thinking about more and more for my own patients is autonomy, not just to drive motor control or engagement, but autonomy for autonomy's sake. That this idea of like self-realization really comes through having autonomy. That we might not just use this as like a tool in our toolbox, but we might actually do it to provide a person a like massive open door, open window to more ability to direct their life, and be a participant in realizing their life goals. So I would say that's beyond a fundamental psychological need. And that was from this really great article. It was back from 2009. Sandman and Muth were the authors on that, which by the way, if you're on our newsletter, I'm going to put some links to some of the great resources and articles that we looked at on Friday in our Facebook Live. I want to go through a couple of the pieces of the literature that I really loved. But that was one particular piece, is thinking of autonomy as beyond just some sort of like little added bonus that we do to this task, but actually like this is a fundamental, deep set need that people have. And it comes up everywhere in the literature. So I feel like we need to show some of our like beautiful little designs here. Remember this one, Chelsea? So we made so many beautiful designs, but this was one looking at the many ways that we already do this at different like steps for the person, but things like motivational interviewing, building self-efficacy, person-centered care, shared decision making with the person, applying behavioral economics, which, by the way, is another presentation Mike Studer has at CSM this year, so you might want to catch that. Also a huge part of our Neuropracticing 4.0 course that he's coming and doing with us. And then just understanding the person's readiness for change. So those are like, we looked at the literature in all of those places to look at how we might apply autonomy in a therapy realm, from like a big picture standpoint of like, what's the purpose of autonomy, that deep set purpose, to just like how and when we do it, which was like, really, Chelsea, I think this was like such a brilliant part that you brought to the presentation, was kind of this framework for people to think of where they might do incorporate autonomy, right?
Yeah, and I love that you like touched on that autonomy is just more than like something you do to drive motor learning. That's probably where I was first introduced to the word autonomy, was through the optimal theory of motor learning. And I was like, oh, like choices, cool, check, I provided autonomy. But there's just so many different ways that you can provide autonomy and you can incorporate it. So we had this whole list of opportunities for autonomy in therapy, and really you can incorporate it in all aspects of care. And obviously, like, not one person needs that autonomy in every single part of your treatment. So like the treatment setting, the interview, the education, helping them understand their diagnosis. You may not throw everything at them, but you're going to see where they need that autonomy based on that individual's goals and what they're looking to achieve through therapy. So yeah, so in addition to like the actual treatment, like interventions, you know, home exercises can be a place where you're incorporating autonomy. Plan of care management and discharge planning is a big one. And, you know, really like every aspect. So we really kind of dove into all the different aspects. And, you know, there aren't examples in the literature. So we took our own clinical expertise and then some of the literature, but there's some literature that has behaviors that facilitate autonomy and understanding. So this was an article by Berger in 2017 that was physicians and looking at behaviors and factors that facilitated autonomy and patient understanding. And, you know, really just like asking if people understand was really valuable. And not making decisions without, you know, incorporating the client. That was like a big one. And so there are some key behaviors that you can incorporate throughout your plan of care that can really facilitate autonomy and can support your client. And then one of my favorite little nuggets was in kind of like our when and where. So we made these like elements of autonomy, and there were 3 elements. We had the when and where, the why, which Julie just went through, and the how. And we talked about in the when and where, like when we're talking about plan of care management and discharge planning, and really just like how to set up our clients for like self-regulation and self-management. You know, Wolf and Luthway in one of their articles talked about how autonomous language versus controlling language is associated with increased self-regulatory responses. And so like, boom, this is like what we're looking for in therapy. And, you know, we really can apply that in all aspects of care, but plan of care management and discharge planning can be really tough in the neurologic population. And so really leaning into that autonomous language being a partner with your client can make all the difference in supporting their own self-efficacy, their increased motivation, and helping them achieve their goals. So those were a couple of the nuggets of the when and where. Mike was kind of our how-to guy, and he had some great videos, but I think the one other little nugget that I found really valuable when making this presentation with you guys was the idea of like over fertilizing or too much autonomy, right? And, you know, I think being a very beginner gardener compared to my husband, who's a very good gardener, I have done this many times, overwatered, over fertilized, like I just went ham, you know, and that can actually be very detrimental. And if we think about that in therapy, you know, providing way too much autonomy without the skill and guidance can be really overwhelming for someone, and can actually increase that cortisol, that stress response, and can really make making decisions and, you know, having motivation really difficult. So there's this fine balance, you know, it's the skill and the art of autonomy. Is providing it when the client needs it and how the client needs it. And that really comes from listening and understanding them, but not overdoing it or having too open-ended of autonomous choices, because that will really lead to overwhelm.
Yeah, exactly. And I think one of the last neuro nuggets or autonom nuggets, like what would you call that? Oh, Allison, thank you. She said, two amazing humans right here. Thank you. That's so nice. So, something I've been thinking about a lot, and I think all of us as healthcare providers have too, is just like how burned out we can get providing really like specialized, individualized, personalized care to people, and particularly if it's a more complex type of case. And in those cases that we tend to see, those are ones that have been stripped of autonomy left and right, right? It's actually part of the underlying pathophysiology of a functional neurologic disorders to lose that sense of self-agency. Mm-hmm. So in those complex disorders, one of the things that we talked a lot with Mike about is also how providing autonomy has a benefit to us as the provider. Mm-hmm. That even us as the giver of autonomy, we even have release of oxytocin and serotonin, for example. And that's something I hadn't really thought about in terms of some of the things that we do. And when we can truly kind of dose and give the right fertilizer, I love that analogy so much. If we can do that right, it actually takes a lot of that, like, I have to be the motivator, I have to be the fixer, like me, the therapist, and really gives the person the ownership of it, which is what the person needs and what often the medical system has taken away. And so it provides that to them. The benefit to us is that we're not going home at night going, oh my gosh, I got to fix everybody's problems, right? So we actually have like an immediate release of some great neurochemicals, but we also, instead of being kind of stuck in maybe like a fixer motivator mentality, we're in an empowering mentality. And that takes some of the burden off of us.
Yeah, you posted a really great quote, I think, on our stories like earlier today that was like, you know, our role is not to motivate, it's to hold space for someone to be open to change, right? It's like holding space and creating the opportunity for change. And I love that. Like, that is such a better way of thinking about our role as therapists, rather than, you know, I think I used to always feel like I was just a cheerleader, which I think I love being a cheerleader in some ways in therapy. I love having that energy, but it can be really hard. It can be really challenging. And I think taking some of the, you know, like you said, some of the feelings of like I'm not doing enough because they're not achieving their goal. It's like kind of, you know, all right, well, how can I set up the opportunity for them to really understand these choices and understand how this might better their life? And then let them choose, right? Because we're all humans and we all deserve the choice, right? So it really does help with that kind of like, I did what I can do. I provided them with that opportunity, and that's really my role.
Yeah. Yeah. And I know I see Liz on here. She said, wow. And just that idea of the patient, the person having and restoring that control.
Yeah.
Allison also says she loves this conversation and topic. And I think that's the other thing is healthcare providers, and anybody, you know, who's been in school for a medical profession, you do kind of learn like you have the knowledge, right? And you have the control. We learn in a very paternalistic
Yeah.
kind of way. I think that's changing. It's moving a little bit. But when I think about Allison, when I think about others who maybe have also I don't want to say victim, but they've received care in a very paternalistic way. Maybe they've had to fight stereotypes about disorders, and fight for control. This is something that many of the people we've worked with have experienced. And a loss of autonomy in our very traditional medical system. This is where I think a little bit can go a very, very long way. Yeah, and Allison's, I value relationships so much more now.
Yeah.
Yes, exactly,
And
exactly.
I
So
even think about like our own growth, you know, at Reactive, diving into like the idea of ableism and how that like comes into play here, because you're exactly right. Like, you know, our medical field is in a very ableist like view, right? And like, you know, when I think about like even the definition of physical therapy, like maybe the idea of preventing disability, I don't agree with that. I actually feel like, you know, we are giving people opportunities, but who am I to say what is the best for somebody in their role and their experience, right? So I think like changing our lens, you know, like we have a specialization to really understand movement. We're movement specialists. We are specialists in how the brain and the body connect. And if we can provide people with tools, they can make those decisions that are best for them and their body, and really like where they are in their life, in their abilities and all of that. So I think my mind shift has changed as I've started to dive into some of the ableism literature. And that's like another area of our practice that we're growing a lot in. So yeah.
yeah, I mean, you can see that we're so passionate about this topic. You can see why we joined forces with Mike Studer to put together this particular topic into a professional presentation. And we'll be very excited to submit it again and be able to do it. The last time we got together, right before the pandemic, it's still really hard. That was 2020, but it was in January, right?
Yeah.
End of January. Myself, Chelsea, Carly Lockala, Mike Studer, we presented on functional movement disorders, and it was a standing room only like group of people, and we got such great feedback that this was really the first time people had heard some of these ideas before. And so we were so thrilled to, like, first of all, maybe be back in person, but to share more. Like, we're going deeper and further in our own understanding of this, how it applies to functional movement disorders, but not even like beyond that, right? To humans and what we do as physical therapists. So you can see we're pretty passionate about it. And Allison says, I can see this in who you are and what you put out in the world. Likewise, Allison. And Liz says, thanks for sharing this topic. It aligns with me too. Well, thank you for being here. And for allowing us to share a little bit of what we would have liked to be in San Antonio sharing, but here we are sharing it with the world anyway. We will continue to share and advocate for this type of maybe deeper knowledge and understanding, and applying it both for ourselves as therapists and for our care with clients. And Chelsea, I want to thank you for joining me today, but also for all that I've learned from you in putting this together. I think that's the sweet blessing of CSM is, yes, it's a great presentation. Yes, it's like you get to be with your colleagues, but it's all of that work, those hours of work that you put up to get there, that is truly like the learning process.
Yeah. And I feel really grateful that the, Academy of Neurology, PT, the neuro section, that they really saw value in this. And I just feel really honored to be, a part of this team who was chosen to present on this topic. So I really hope we have the opportunity to present in the future. Again, we're super passionate. And yeah, like I learned so much from putting together these presentations. I mean, I'm doing a presentation on telehealth for the APTA in April, and I'm just learning so much. It's just like, it's fantastic. So I think it's like just a really wonderful opportunity and just like a chance to grow as a therapist professionally. And I'm glad we were able to chat. I'm glad we were able to work together and celebrate it a little bit. I know we're both really sad that we're not.
I know. We are both really sad. We're going to go have a sad dinner together tonight after this, or a sad but celebrative dinner. We're celebrating that we're taking care of ourselves, and we made a tough decision in that. So I know we're not alone too. We had other members of our Brain Bites crew, amazing posters and presentations they shared with us last week that they're also not able to travel and share at CSM. So I know we're not alone. We're going to keep sharing this, all that we're learning and doing with people anyway, here on social media and in videos and in our courses and all of that. So thank you everyone who joined us today. Hey Bella, thank you for being here. We hope you all have just a wonderful evening, and join me on Friday if you want to hear a little bit about some of the literature that really kind of tickled me in the autonomy world. And then join our newsletter. It's at reactiveeducation.com if you're a healthcare provider, or reactivept.com if you're a person with neurologic disorder. Either way, join our newsletter. I'll put all the research and resources and things that we talk about every week. So thank you all. Thanks for being here. Thanks, Chelsea.
Bye.
Bye.